The COVID-19 pandemic has further strained an already ailing healthcare system. Even pre-COVID-19, there was a national nursing shortage, especially in critical care. During the pandemic, this shortage would have become unimaginable without the ability to expand the scope of care provided by the Certified Registered Nurse Anesthetists, known as CRNAs.
Those of us in the advanced practice nursing world have been kind of beating this drum, for decades now, that we were an incredibly underutilized workforce inside of healthcare. Many states in the country, CRNAs operated under archaic, restrictive scopes of practices that didn't allow them to function at the top end of their licensure in a day-to-day environment. Interestingly enough, when the COVID pandemic came to our shores, the mentality shifted into an all hands on deck. We started hearing rhetoric about we're at war with a virus. The mentality perseveres in that you want everybody that's going to participate in the fight to be able to do everything that they possibly can at a time when they may never have been more interested than they were right now in understanding how these providers can be utilized to their maximum extent.
Very early March, we started seeing patients and have positivity testing. It was just happened so quickly. And we ended up converting most of the hospital, the inpatient hospital, to COVID. But the criticality really occurred in the ICU in the fourth floor. We needed help. We ended up requesting the CRNAs to provide for us additional help, certainly because of COVID, but to support the intensive care primarily, and we couldn't have done it without them. This was something that no one had ever experienced before. It was very hard on the staff. Again, the CRNAs provided a lot of support and relief.
It was overwhelming. We needed somebody at the bedside who was able to intubate, put in central lines, manage critical care medication. It was a seamless integration into the ICU team. It almost normalized patient care in the ICU.
Due to COVID-19, there simply were not enough healthcare providers to staff ICUs and distribute vaccines. However, with proper allocation of certified registered nurse anesthetists and nurses, hospitals, long-term care facilities, and the vaccination effort were better prepared to meet demand.
Obviously, every American was following the news, and the entire world was watching with great anticipation for the vaccine solution. And the acute care facilities, hospitals essentially, and skilled nursing facilities were first, as those were the populations that were at greatest risk. So even though we had been planning for several months, we only had 10 days between the formal FDA approval and the go live of the clinics. And what that meant was we had to have the clinics stood up, staffed, and vaccines ready to go into patients' arms. It was quite the push to make that happen.
Nursing in itself is one of the largest healthcare workforces out there. We are so underutilized, meaning CRNAs, APNs, advanced practice nurses. We have been critical care nurses prior to coming in, and we have that knowledge base. When you think CRNA, you think, oh, that's a person that intubates. That's a skill. It's a very important skill. But it's not the only thing that we bring to the table. We have the knowledge base for all of the critical care medications, the drips that these acute critical patients need. And for COVID specifically, proning a patient was very important. Now, proning means putting a patient on their belly. Now, when I was an ICU nurse, I never thought ever that we would put a intubated, ventilated patient on their tummy. That was like unheard of. Fast forward to anesthesia, and we do that on a daily basis.
UltraCare is committed to healing the ailing healthcare system by optimizing the healthcare workforce. They quickly responded to the COVID-19 pandemic by effectively mobilizing certified registered nurse anesthetists, nurses, and other healthcare providers nationwide to aid in critical care ICUs and with the national vaccination efforts. UltraCare teams have administered vaccines to over 200,000 Americans. UltraCare continues to provide hope to the medical community and families nationwide.
We took the available workforce that we had. We looked specifically at the skill sets that they had, not just in their education and training, but as they've developed as professionals throughout the course of their work. Step two was gauging their willingness. And that has been one of the most humbling experiences for us as executives in the company. Coming from healthcare as nurses, as certified registered nurse anesthetists, as physicians, and managing a healthcare company, we weren't strangers to the idea of running into the fire when everybody else was running out, right? Knowing that we had a skill set and a knowledge base that the general public doesn't have, and bringing that to bear to solve problems. But this was completely different. There was so much unknown about its transmission, its virulence, and the most humbling part about it was that there was never a shortage of people contacting us from our national provider workforce to say, you name where, and I'll be there in 48 hours. If you can get me on a plane or you can get me a rental car, I'll drive through the night to get there.
Our primary focus was to ensure that our core business of timely and accurate medication services was not adversely impacted while we delivered on the humanitarian response. Our partnership with UltraCare made that possible in every way. I have never, in all of my years, worked with a partner that had the depth of a bench of providers that UltraCare had, and they were really a partner that we were able to turn to quickly and be able to dispatch on short notice across multiple states.
UltraCare responded to the need for specialized nurses nationwide. They effectively deployed certified registered nurse anesthetists and other healthcare professionals to aid ICUs and vaccine distribution on the front lines, which continue to give hope to the medical community and families nationwide.
I have to tell you, the amount of courage that I saw from my colleagues was just astonishing. Facing patient after patient after patient and quickly putting together our knowledge and expertise, our experiences. We are trained to react calmly in any emergency situation, but with certainty, with knowing what we're doing. I'm very proud to be a CRNA.
We founded UltraCare to do what others are not doing. First and foremost, our patients are going to be first. Second, respecting our providers and our professionals.
To date, UltraCare Anesthesia Partners in its management of the COVID-19 pandemic has worked with multiple large hospitals in northern New Jersey, has provided consultation services to large health systems throughout the state of New Jersey and in other states as well on how they can manage or better manage or optimize their healthcare workforce. We've mobilized dozens and dozens of certified registered nurse anesthetists from every corner of the country to the facilities that need them the most. In terms of UltraCare Anesthesia Partners' response to the vaccination effort, we've effectively been able to operate in hundreds of long-term care facilities in, I believe it's at least 8, if not a dozen states to date.
To learn more, contact us today.